Is physiotherapy effective for traumatic brain injury? The primary goal of physiotherapy is to promote neuroplasticity. Neuroplasticity refers to the body's ability to heal itself. Traumatic brain injury is a common cause of neuroplasticity in adults and children. Neuroplasticity refers to the process whereby the body repairs itself from brain injury, and as such, this article will describe how physiotherapy can promote neuroplasticity. Injury to the head or neck is the most common cause of traumatic brain injury, and traumatic brain injury is the leading cause of death for children and adults. Injury, such as a car accident, can damage the brain and cause it to experience neuroplasticity in many ways. Traumatic brain injuries can be caused by trauma to the brain itself, injury to the brain's blood vessels, injury to brain cells, and injury to the brain's synapses. A traumatic brain injury causes a wide range of injuries to the brain's neurons and glial cells, including severe brain tissue injury, subdural hematomas, which is a bulge in the skull, subcortical hematoma, which is a mass of fluid under the skin, and intracerebral hemorrhage, bleeding that occurs near the brain. These injuries cause both short-term memory loss and neurological dysfunctions. Because traumatic brain injury often affects the motor cortex, which is responsible for movement, physiotherapy often focuses on post-traumatic motor control and rehabilitation. One method of this rehabilitation involves applying soft tissue traction to muscles and soft tissues affected by the injury. Also, physiotherapy often treats the entire area of injury by utilizing exercises and stretches. In some cases, physiotherapy may treat specific injuries such as facial lacerations, or even injuries resulting from a single trauma. Physiotherapy is also commonly used in the treatment of other problems such as stroke and neuropsychological deficits. A stroke occurs when the brain fails to respond to a specific stimulus, such as pain or incentives, which causes it to experience the opposite response, such as not responding to a light stimulus. This type of motor impairment is prevalent in adults due to aging. It can cause a wide range of complications, including decreased motor functions, reduced muscle strength, function, and an increase in disability. And/or atrophy of motor regions, such as the cerebellum, hippocampus, cervical motor nuclei, the basal ganglia, or other related areas. These disabilities can impair activities of daily living and lead to more permanent limitations. Neuroplasticity is vital to the rehabilitation and recovery process because it allows injured individuals to recover without using their full strength. It helps people develop new skills to cope with everyday tasks. Physiotherapy promotes neuroplasticity in the treatment of traumatic brain injury because it can improve motor function and cognitive function. In the treatment of stroke, physiotherapy uses exercises and stretches to reduce the effects of neurological deficits on brain functions and activities. While it is still unknown why neuroplasticity is affected in stroke patients, it is believed that it is a result of a decrease in myelin production, which is a protein found in the brain's outer layers. Physiotherapy also helps to increase neuroplasticity in patients who suffer from neuropathic pain. Neuropathic pain occurs when nerves are damaged and cannot receive the messages they need to perform their normal functions. A recent study suggested that a group of drugs commonly used in neuropathy treatment may affect neuroplasticity, causing the body to be less resistant to medications and even more pain. The reduction in motor function caused by neuroplasticity is a significant disadvantage. When a patient suffers from a traumatic brain injury, physiotherapy is essential to improve their ability to move and coordinate specific tasks. And even to return a patient's ability to communicate and use his or her limbs again. Some of the rehabilitation programs used include physical exercises, cognitive behavioral therapy, and biofeedback therapy to help the patient regain balance, coordination, and the ability to use his or her limbs. These rehabilitation exercises are typically done in the same environment as the patient's daily activities, to minimize the amount of time spent resting. If you suffer from a traumatic brain injury, you may have questions about how physiotherapy has affected your condition. The first thing to do when experiencing any changes in your medical or mental status is to seek your doctor's advice. Physiotherapy treatments are not recommended for all patients, and your doctor should be consulted about them. Even if your symptoms are only mild, a consultation with your doctor is necessary to determine if it is in your best interest to pursue physiotherapy. As long as you are aware of what your injury is like and if it is in your best interest to pursue physiotherapy as part of your treatment plan, your condition is more likely to improve. You will begin to regain the ability to perform regularly, as soon as you are able. After rehabilitation, you can consider continuing with physiotherapy. This will ensure that you never feel restricted again and that your neuroplasticity is restored to its normal state to go back to your everyday life. Thank you.